Hey everyone, welcome back to the Caring Compass. In today's video, we're diving into a topic that's super important for your health: antibiotics. We've all heard about them, but what exactly are they? How do they work? And when should we be using them? If you've ever been prescribed antibiotics, or wondered about the difference between bacterial and viral infections, stick around, because we're about to break it all down. First things first, antibiotics are powerful medications used to treat infections caused by bacteria. They work by either killing bacteria directly or preventing them from growing and multiplying. Now, let's clear up some confusion right away. Antibiotics only work on bacterial infections, not viral ones. That means you can't use antibiotics to treat things like the flu, common cold, or COVID-19. Those are caused by viruses, and antibiotics don't do anything to stop them. So, what's the difference? Bacteria are single-celled organisms that can live in many places in our bodies. Some are helpful, like the bacteria in your gut that help digest food, but others can cause infections. Viruses, on the other hand, are much smaller and require a host cell to reproduce. This is why antibiotics are ineffective against viral infections. Okay, so antibiotics help with bacterial infections, but how do they actually work? Well, there are different types of antibiotics, and each works in a slightly different way. Some may block the bacteria's ability to make cell walls, while others interfere with the bacteria's ability to produce proteins or replicate their DNA. For example, penicillin targets the bacterial cell wall, weakening it until the bacteria bursts. Other antibiotics like tetracyclines stop bacteria from making the proteins they need to survive. Now, it's super important to talk about antibiotic resistance. This is when bacteria evolve to become resistant to the drugs that are supposed to kill them. This happens when antibiotics are overused or misused. For example, not finishing your full course of antibiotics can leave behind bacteria that are stronger and harder to kill. And when we keep using antibiotics too much, we give bacteria a chance to build resistance. When it comes to antibiotics, take your doctor's advice on whether you need them or not. Never take antibiotics for viral infections, and always finish your entire prescription, even if you start feeling better. Antibiotic resistance is a big problem. Taking antibiotics when you do not need them can mean they will not work for you in the future. By doing so, you're helping prevent the spread of antibiotic resistance. Okay, now let's talk about some common side effects of antibiotics. While they can work wonders, they can also cause some unwanted effects. Some people experience nausea, diarrhea, or an upset stomach. Some people may develop an allergic reaction to antibiotics, especially penicillin and another type of antibiotic called cephalosporins. In very rare cases, this can lead to a serious allergic reaction, anaphylaxis, which is a medical emergency. You get a skin rash that may include itchy, red, swollen, blistered or peeling skin. You're wheezing. You get tightness in the chest or throat. You have trouble breathing or talking. Your mouth, face, lips, tongue or throat start swelling. And remember, if you ever experience these severe side effects, you should stop taking the antibiotic and contact your healthcare provider immediately. Some antibiotics are not suitable for people with certain medical problems, or women who are pregnant or breastfeeding. Tell your healthcare professional if you're pregnant or breastfeeding, so they can prescribe the most suitable antibiotic for you. Only ever take antibiotics prescribed for you. Never borrow them from a friend or family member. Some antibiotics do not mix well with other medicines, such as the contraceptive pill and alcohol. Read the information leaflet that comes with your medicine carefully and discuss any concerns with your pharmacist or doctor. Be sure to have an open conversation with your healthcare provider about your symptoms and medical history. If antibiotics aren't needed, they may recommend other treatments to help you recover. Now let's talk about types of antibiotics. There are several different types of antibiotics. 1. Penicillins such as penicillin, amoxicillin, co-amoxiclav, flucloxacillin and phenoxymethylical. 2. Cephalosporins such as cephalexin, cefazolin. 3. Aminoglycosides such as gentamicin and tobramycin, amikacin, neomycin and streptomycin. 4. Tetracyclines such as tetracycline, doxycycline and limecycline, methocycline. 5. Macrolides such as azithromycin, erythromycin and clarithromycin. 6. Fluoroquinolines such as ciprofloxacin and levofloxacin. Alright, that's a wrap for today's video on antibiotics. I hope you now have a better understanding of what antibiotics are, how they work, and how to use them responsibly. If you learned something new, don't forget to subscribe for more health tips. Stay healthy, stay informed, and see you in the next video.